Hello and welcome to the third episode of Your Comfort Place, our show for exploring health matters with Dr. Patrick Wynne. I'm Bernard Gins, a communications consultant with a background in newspaper journalism, and I do quite a lot of work in the healthcare sector, especially in technology, research and innovation. I'm delighted to be joined again by Patrick. As some of you will know, Patrick is a senior GP, a hospital specialist at Jimmy's in Leeds, a clinical entrepreneur and a provider of medical services to horse racing events. Patrick is also Chief Medical Advisor to Caversham Health, which specialises in British designed pressure care and mobility support products for sitting, sleeping and moving. So welcome back, Patrick.
Thank you very much.
Before we start, you've been a GP for many years. In your experience, what do people look for in a GP?
That's a really interesting question. I think different people will seek different things. I think the older generation are very different to the younger generation, and I think you have to reflect that in the way that you communicate. Certainly, the younger generation might ask a lot more probing questions, which is good and healthy, but equally, the older generation frequently just want to be told what to do, and you're the doc. And it's horses for courses. So I think the most important thing and what is really central to good general practice isn't so much whether the individual is one way or another, but it's about finding the person that you gel with and having the ability to see that same person consistently, to build up that rapport over time. And for me, as a doctor, it's a delight to get to know my patients. And we don't have to go over old ground. If I know somebody well when they come in with whatever presentation, we're halfway through the consultation already. So I think probably the most important thing is that finding the right person and being able to stay with them.
We hear about information asymmetry in healthcare, particularly in hospital settings where the consultant is almost like God and the patient doesn't know very much and is often frightened. How can you overcome that in general practice and primary care?
You can't imagine how frequently this comes up. I will have people who have had a specialist appointment, or in fact they've just looked on the NHS app, which is wonderful having access to your own data, but it needs interpretation. And you may have had a specialist appointment and the specialist has written a letter and sent a copy to the patient, and it's full of medical terminology, some of which can be very scary, literally. For example, the word tumour in lay terms means cancer, but actually in medical terms does not. So you can have a benign tumour, but you read the word tumour and understandably it sets up.
You're running for the hills,
yeah,
aren't you?
Absolutely. Yeah. So part of my role as a GP is I find myself translating. So translating things that people have found, often data, particularly on the NHS app, which is new and it's a bit crude, I'm sure it will develop, can look scarily abnormal, and actually when they talk to me I'll be able to say it's absolutely fine, that's just the way it's written. I can think of examples of acute kidney injury. The way it reads on the app sounds like you would feel you had an acute kidney injury. It's actually saying you haven't, but the way that it appears doesn't make that obvious. So I spend a lot of time translating and making up for the asymmetry, which is understandable, and it's good that people are engaged with their health and are asking those questions. So I'm always pleased. I always think it's healthy when people seek that kind of clearance and want to know.
And how do you put people at ease when they walk into your practice?
You've got to spend the time going through it and explaining. I sometimes think it's a bit of a shame. I might say to somebody, I think this is the condition, your rash is this diagnosis. And they'll look very confused. I think, well, I think it's something else. And then we'll look it up on Google. And when they see a picture on the screen that exactly matches their rash, they're very satisfied. I think after 30 years in practice, you won't take it from me. But if Google says so, it's fine.
Dr. Google.
Yes, but done that way round, it's very powerful. So using Google to support, rather than if you ask Google a question, it will inevitably spit out the possibilities.
Yeah.
And if you ask, is the worst possible, well, the answer is always yes, because it's possible, but you might need a little bit more in depth to understand the probability of it, which is very different, and that's where the human interaction comes, where we can explain that yes, whilst it's possible for all these reasons, it's not that.
I suppose that's where translation comes into it, isn't it?
Mm.
And can you also explain what you do with horse racing events as well?
Horse racing. Horses have been part of my life from childhood. I've always had horses, been around horses, rode horses. And when I first became a GP, in fact, I was invited to Pontefract Racecourse, which is in Yorkshire, as a doctor to pick up the jockeys when they fall down. That's probably the best way I can describe it. I love horse racing, I love horses, so I enjoy working there. And yeah, we are very important in resuscitating injured jockeys, and obviously people in the crowd. People have cardiac arrests from time to time, and it all happens, and I thoroughly enjoy it.
What's your favourite race course?
You're putting me on the spot now. I've got to be very careful because this is going to go out and I don't want to offend anybody. I would say my favourite race courses are always the smaller ones. So I work at York, for example, which is an absolutely fantastic race course with some amazing racing. But I think when it's so big and so crowded, it's more impersonal. You can't get as close to the horses. I go regularly for entertainment, and you struggle sometimes to get through crowds and actually see the horse racing. Whereas the smaller courses, Pontefract where I started, Beverley Racecourse in York, another smaller course, Market Raisin I cover, these are all much smaller and more personal, and you get closer to the horses, and those are the things that I enjoy.
It's a great day out, isn't it?
It is a great day out.
Okay, today we're going to be discussing the issue of wheelchair comfort, which is a big question for the 750,000 people in England who rely on wheelchairs. There's actually some uncertainty around the actual number, as users can get their wheelchairs from different places, such as directly from the NHS or indirectly but funded by the NHS, or from a charity or paid for privately. Wheelchairs give increased independence to people with mobility issues, and they open up the world of work, education and social life, which is especially important as disabled people are almost twice as likely to be unemployed as non-disabled people, according to Scope, the charity. And looking at what makes a good wheelchair, according to the World Health Organization, it defines an appropriate wheelchair as something that benefits health and quality of life by reducing problems such as pressure sores and progression of deformities, and improving respiration and digestion. It defines a wheelchair as appropriate when it meets the user's needs and environmental conditions. It provides proper fit and postural support, is safe and durable, and can be obtained and maintained at an affordable cost. So that's an overview. Patrick, we've heard what the WHO has to say about appropriateness. I'd like to find out a bit more about the reality in the UK and ask you some questions about any sort of practical issues. In your experience, what proportion of wheelchairs sort of meet the needs of their users?
It's very difficult to answer that accurately, and it's not something I could say is evidence-based. I probably see disproportionately more people because their wheelchairs aren't right, and I would hope that there's a lot of people out there whose wheelchairs are working perfectly for them and I would never be aware of it. But the people that might come to see me will have, I don't know how to put it, related issues. They might have shoulder problems because they've been given something that they're to propel themselves, and they don't have the strength, or they're aged or whatever, and they'll present to come and see me with a shoulder problem, but it's actually a consequence of their wheelchair, and perhaps they need to have a self-propelled wheelchair because they're no longer physically up to it. So I will see, I guess, disproportionate numbers of people, but it's something that doesn't happen every day, but is something that I will see fairly regularly. Someone will come in with a wheelchair and have musculoskeletal pain related to it. That could be neck, shoulder, back, or Paris the thought, pressure sores, which of course are dreadful things. And once they get started, if they're not addressed, they can be a long-term problem.
What impact does an inappropriate wheelchair have on a user's health and also the quality of life as well?
Well, firstly, if the wheelchair causes injury, as we've just talked about, then that's direct harm. But if the person isn't suited to their wheelchair, if it doesn't work for them, they're not going to use it. And all of the benefit that comes with the wheelchair, which is access to the outside world, access to work,
liberty.
Yeah, absolutely. And the well-being that brings is lost because the chair doesn't deliver.
You mentioned pressure sores. What are the problems of pressure sores? What are they? How do they happen? What are the risks? And then also, what about the progression of deformities and things like respiration and digestion that able-bodied people take for granted?
Yeah, absolutely. So pressure sores are really important things, and they are, as they sound, pressure sores. If you or I were to sit on a hard bench, after a little while we might feel uncomfortable and shuffle around a little bit, and that's because the skin underneath us is being compressed and starved of blood. If you haven't got that sort of mobility or sensation, you might remain sat on that hard seat until such a time as you'd actually killed off the skin. You've caused the skin to break down through lack of blood supply.
And how long can that take?
And it doesn't need to be very long, and it depends. It's very complex and very scientific, and it will depend on your medical condition, your weight, your health, your nutrition. Nutrition is terribly important for skin health, and multiple factors. And if you are, for example, shoehorned into an ill-fitting wheelchair, it may not be underneath you that gets it. It could be the side that's rubbing against something that's not fitting correctly. Just as if you had a bad pair of shoes and you walk around and you get a blister.
You'd know about it.
Yeah.
Can you explain the issues with deformities progressing as a result of a sort of poorly fitting wheelchair?
Yeah. Well, I go back to the people arriving with musculoskeletal injury because they're using, and it could be any appliance, in this case wheelchair, incorrectly, or it's an incorrectly fitting appliance. My role generally with wheelchairs is to make a referral for a wheelchair assessment, and that's critical. It's an assessment. It's not just here's a wheelchair, and the wheelchair needs to be the right height, the right size, the right width, and provide the right kind of support for somebody, and that is going to be very variable. Somebody who is an amputee, a lower limb amputee, may well have good core strength and the ability to turn the wheels themselves, normal upper limbs, and the wheelchair that would be suitable for them would not be suitable for somebody who might have multiple sclerosis, and they've got difficulty with controlling all their limbs. They may not have core stability. Somebody who's had a spinal injury might not have core stability, and you put them in the same wheelchair and they'll have a problem, and that might then over time lead on to postural problems, deformities and such, because it doesn't fit them right.
Okay. And issues with respiration and digestion can also follow on from inappropriate wheelchairs. How can you treat those?
Well, it goes right back to that wheelchair assessment. That's the key thing, is to not get into that situation. If you're stooped over and not breathing well, then you need to be sat upright in the right position. If you haven't got the spinal core support to do that for yourself, you need a wheelchair that suitably provides that. But as I say repeatedly in these podcasts, prevention is better than cure, and that's where I go back to the wheelchair assessment being critical to it.
Okay, very good. I've been reading about issues with long delays in the supply of new wheelchairs and parts in the UK, which has been highlighted recently by the Parliamentary and Health Service Ombudsman. What are the consequences for individuals of those delays, and what advice would you give to users in the meantime?
Obviously, it's a dreadful situation that the NHS has waiting lists across all services throughout the NHS, and sometimes those are very patchy. I'm not aware of a problem in my area. I say I'm not aware of it because I make the referral and then it's out of my hands, but There may well be areas where the service is fantastic and areas where you are waiting. The problem, obviously, for people waiting is that they're not getting all of the benefit that suitably fitting wheelchair brings. So they're not getting the social interaction, they're not getting the exercise, they're not getting the stimulation, they're maybe not able to go to work. All of those things being delayed is obviously an impact, and in that time people's health can and will decline. What advice could I give? Well, I know that a lot of people choose to purchase a wheelchair independently. And perhaps it's a shame that the NHS hasn't provided for them, and it's another debate. My advice would be that if you are going to do that, make sure that it comes with a wheelchair assessment. Just buying a chair and assuming it's a chair, it'll be fine, might be okay for some people most of the time, but if you've got particular needs, the chair needs to address those needs. And we talked about posture, and I think pressure sores is something you've really got to think about, because once pressure sores are started, they are long-term chronic problems, and a wheelchair with a hard seat, and I talked about sitting on a wooden bench before, if you effectively put somebody whose nutrition might not be so good, their skin's thin because they're old and frail, and they might be quite skinny and bony, and you put them onto a hard seat, you have every possibility of creating a problem in the form of pressure sores.
How do you treat pressure sores?
So pressure sores require long-term treatment. They're generally dressings and avoidance. So if you've got a pressure sore, you need to avoid repeating the pressure sore. So if it is unfortunately
It's
where
quite
you sit,
difficult if you can't do anything but sit down.
it is very difficult, which is why prevention is far better, and it's why they take such a long time to recover, or in some instances just never recover. So it's absolutely critical to not allow a pressure sore to develop.
So some of it, I suppose, is about wound management. And have you seen any sort of technology advances in wound management?
Do you know, wound management's generally done by the nursing team, and this is likely to be the community nursing team. So
going around visiting people at home.
And as a GP, I might get called in to prescribe an antibiotic or to prescribe a special dressing or something. But the specialist dressings have advanced, but they are managed by tissue viability nurses. It's actually a very specialised area. And again, perhaps my role as a GP might be to get somebody the care from the tissue viability nurse, from the specialist. But absolutely, they would lead. I just do as I'm told and issue the prescriptions.
Okay. What are you seeing in terms of medical products that can help, that can maybe provide some hope to wheelchair users?
Yeah, well, the obvious thing here is the cushions that go within those. So I talked about the hard seat on the wheelchair, and those sort of wheelchairs that collapse and fold up and open up are very practical. You can put them in the back of a car, etc. But you wouldn't want to be sitting on the basic seat without something on it. And that's where the cushion comes in. And so we're not just talking about a cushion for your sofa. This is something that is medically designed specifically to prevent pressure sores, and that's critical because we don't want to allow a pressure sore to start. So if you were looking for cushions, you would need to look at something that is medical grade, and the way you can look at that is to say, well, does it have a risk assessment? So, or a risk score, sorry. Yeah. So people that are at high risk will need a cushion that provides appropriate protection for them, and then there's medium risk and there's low risk, and you would need to make sure that you bought a cushion that was appropriate for that. That would be covered in an NHS wheelchair assessment. So there's a score. It's very scientific. There's a score, and a patient will be given a number, and that will put them into one of those categories, and the cushion that they use or padding for whatever would be appropriate to their needs. The same applies to mattresses. So for a medical grade mattress would be tiered to match the risk.
And as a rule of thumb, what things should people look for when they're buying these kinds of products? And where should they be buying them from as well?
It's easy to say a reputable provider. Where there's been an NHS service involved and you might wish to buy others, you may well have your risk stratification. You may know that this is the level of risk that you require to cover. But I would suggest that probably the easiest rule of thumb is to make sure it has a risk score or risk staged high, medium, low, because that should mean that it's been through that level of assessment. If it's just another cushion, then that might be fine for your sofa at home, but it's not something that you want to be putting on a wheelchair.
Okay, so look for the risk score, and if you're buying a wheelchair privately, make sure you get an assessment as part of it.
Yep.
Okay, I think those are the key messages for me. What's the main sort of takeaway for you on sort of wheelchair usage and wheelchair comfort?
I think it's like any article that I mentioned shoes before. You really want it to fit you and to fit you right, and I would recommend a reputable dealer. I'm sure, I know wheelchairs might get passed around in families and things, and that might be fine if it's used from the front door to the car and that's it. But if somebody's going to spend any significant amount of time in a wheelchair, it needs to be done properly.
Okay, so do it properly. Okay, thanks Patrick.
Thank you.
Stay in touch with Caversham Health at our social media channels and subscribe to our show on your podcast or video platform of choice. And we'll catch up again at your comfort place in the future. Thank you.